Hi, my name's Kate McNeil, and I'm the producer and showrunner of CSAP Science and Policy podcast. As many of you know, we've recently wrapped up our first season, a 17-episode collaboration with Cambridge Infectious Diseases and the Cambridge Immunology Network. Throughout that season, we explored science, policy, and pandemics. In episodes 15 and 16 of that series, we explored how the COVID-19 pandemic is impacting India and how the pandemic has shone a light on inequalities in cities. Today, I'm delighted to be able to share a mini episode in which we follow up on those themes as I sit down with VK Madhavan, Chief Executive of Wateraid India, to discuss some of the challenges his organization has faced during the COVID-19 pandemic. Welcome, VK.
Thanks.
Would you mind getting started by giving our listeners an overview of your organization's core mission and work?
Wateraid India works on water, sanitation, and hygiene. We seek to try and ensure that families that we work with have access to safe and assured water delivered through pipes and taps at the household level. We focus on safely managed sanitation and on hygiene behaviors pertaining to hand hygiene, safe handling of water and food. And we look at the interplay between water, sanitation, and hygiene in three different kinds of institutions: early childhood care centers, schools, and healthcare facilities. We work in parts of rural India as well as in parts of urban India, but with primarily the most vulnerable and low-income families.
What unique challenges has the pandemic posed in the context that your organization works in?
So the first challenge that we were confronted with was the fact that we went very early into a lockdown, and we went into a complete lockdown. From a program perspective, you need to be able to engage with families, to interact with them, to disseminate information, to work with them on improving infrastructure. And so that requires mobility. And so the first challenge that we were confronted with was the complete loss of mobility nationally. The second challenge was that a lot of our work is on actually leveraging resources that the government already has allocated for improvements in water, sanitation, and hygiene. And therefore, our approach or our pathway to scale is to actually build the capacity of institutions at a village level, institutions of self-governance, to build the capacity of leadership and collectives in urban slums so that they can leverage resources and assistance from government. All of this requires mobility.
How did your organization work to overcome these challenges?
So early on, within the first 2 weeks of our going into a complete lockdown, we decided that we would try and use mobile phones to reach out to families and communities that we work with, both in an urban and a rural context. And we created an 8-day campaign where over 8 days, each day we were providing a different set of messages, starting from what are the symptoms of COVID that you should be aware of, how do you protect yourself, what are the preventive measures that you can take, to then talking about the importance of hand hygiene and other precautions to be taken if you're going to use community toilets or use community standposts to draw water out of. We were quite taken aback by the response. We had apprehensions. We had our own preconceived notions about, for example, the fact that ownership and access to mobile phones will not, there will be a gender dimension to it, so women are less likely to have access to it than men do. If we felt that there were poorer people who would have less access to mobile phones than those who were better off. But strangely enough, we found that we were able to reach a significant number of women, and we were able to reach a significant number of poor families that we tended to work with as well using basic phones. We were surprised that in the end of the 8-day campaign, on a daily basis, we were reaching just over 1 million unique users on a daily basis. Now, assuming that an average family size is 5 people, you're talking about straight away being able to reach out to 5 million people. But we also then discovered that communities are very innovative on their own. And we started to see the impact of what had happened. We saw posters going up in village shops about the importance of physical distancing. And we'd have community groups suddenly then take photographs and send it back to us. So it was almost like there was a feedback loop. We got photographs of people where they had taken old abandoned bicycle tires and spread them out at a distance close to where the hand pump was, where each abandoned bicycle tire was a spot where someone needed to stand. So it was a way to show that you have to maintain physical distancing while drawing water out of a hand pump. And so you had a photograph of people standing in these abandoned bicycle tires, all at safe distance from each other, waiting for their turn to draw water out. Some villagers also, announced these messages using a loudspeaker at the village level. And we discovered that we managed to reach another 140,000 people just through use of loudspeakers at a village level. One of our partners runs a community radio program. They managed to reach out to 300,000 listeners using that. So that was our first attempt at actually trying to get messages out, which we felt was the first need after the country went into lockdown. Simultaneously, we felt there was a need to start to engage with government to also inform them. So we started to look at what are specific areas that you need to do. If, for example, it was very clear that access to water was very important if you wanted hand hygiene, and we felt that this was going to be a big challenge, particularly in urban areas where there was a greater risk of fairly speedy spread of the infection, where particularly in slums where the urban poor reside, they tend to live in very close proximity to each other. Physical space is at a premium. A lot of them are dependent on fetching water from community standpoints and also have to rely on public or community toilets. And we were very concerned about what would happen if, for example, if there's no access to water in these places.
How did your organization work to help cities overcome some of these challenges in slums?
So we started to then engage with government wherever we work to try and ensure that at least there was an emphasis on trying to make sure that people had access. We quickly, in areas that we worked in, identified based on past trends as to which settlements were likely to face a water problem, and then decided that our first response would then be that whenever mobility was possible, to try and focus on an emergency water supply situation, even if it required short-term measures using tankers. We then spoke to government about possibility of waiving user charges for people using public and community toilets. We felt at a time like this where it wasn't just that you were scared of COVID, but there was also an economic crisis. We felt it was important to waive user charges for community and public toilets so that at least that does not deter people from actually using these facilities. In some places, state governments or municipalities on their own decided to go and waive these charges. Some state governments have taken the step of actually waiving water charges for a short period of time.
Do you think that the pandemic has shone a light on lack of access to wash amongst the urban poor in India?
I think one of the things that we've discovered through COVID is that it has exposed the existing vulnerabilities of the urban poor. And it's exposed the vulnerabilities of the urban poor. So we've seen the economic toll that the lockdown has had on them. What we've also discovered is that the appalling conditions in which they are forced to live in have also rendered them the most vulnerable. I think what we've discovered to our horror is that cities cannot survive without migrants, but we're inherently hostile towards migrants and treat them very poorly. I think one of the lessons that we should learn from this, that if we want to prevent outbreaks of this kind to occur again in any of our large cities in India, we'll have to completely relook at how we plan housing settlements for the urban poor. We need to look at how we're planning for provision of water and sanitation services for the urban poor, where you should ideally be looking at services within the household rather than compelling them to have to use public facilities for both fetching water and for sanitation. And I think all of this will require investment. All of this will require political will. I think one of the tragedies is that while COVID has made it very clear that hand hygiene is important, we're not seeing an equal attention to improve or invest in access to safe, assured water and sanitation services at a household level.
As lockdown in India eases, what are some of your organization's next priorities?
So our emphasis at this point of time is on, in a rural context, ensuring water supply, to ensure that where there are functions, systems that were defunct, if with a minimal amount of effort they can actually be restored or rehabilitated, to go ahead and do that so that access to water, because it wasn't just COVID. We were also worried about the onset of summer, where traditionally systems tend to fail either because of power outages or simply because the groundwater level has gone down. So our first response has been to focus on provision of water through short-term measures if possible, and in some cases through medium, long-term measures. The second has been to work with government to look at when schools are going to reopen. We've actually put together a campaign where we're hoping that when schools reopen, within the first 24 to 48 hours, we will start running classes for children in the schools that we have access to, where we will then provide them with information on what precautions that they need to take when they're using toilet in the school, when they're drawing water from common water stations in the school, to make sure that they have the right precaution. We're also looking at the possibility, we've designed a campaign which looks at specifically parents of children between the ages of 2 and 5 who are likely to attend early childhood care centers. We will go to families who have children who are likely to attend these early childhood care centers and provide them with the information elders in the family with information that we would want them to try and instill in their children, so that when children start to go to early childhood care centers, those don't fall prey to contamination risk. The third thing that we're focusing on is to look at retrofitting, because a lot of hand washing stations, a lot of toilets in schools, early childhood care centers, or even in public facilities, healthcare facilities, have not been designed keeping COVID in mind. So how do you try and make sure that you have adequate hand washing stations, adequate toilets, to try and make sure that you have systems in place that will allow for the adoption of hygiene behaviors?
We're just about out of time, but do you have any final thoughts for our listeners?
Just one other thing that I should mention. Not just in India, but in all parts of the world, we've seen that governments, communities have recognized the important role of healthcare professionals. They have celebrated the efforts and the contribution made by paramedic staff, by nurses, by doctors. All of this is absolutely critical, and it's important that we've actually recognized the contribution that they've done. Unfortunately, we've missed out sanitation workers. We should recognize the sanitation workers are also public health professionals in some sense. And they've played a valuable role. If they're entering septic tanks, if they're going to clear sewer lines that are blocked, if they're helping in managing waste from hospitals or from public facilities, sanitation workers are also in some sense public health professionals. And we've not seen an investment in looking at personal protective equipment, in social security, in caring for sanitation workers through all of this. And it would be a tragedy if we were to separate those involved in the provision of water sanitation services, if we were to separate those who are responsible for keeping our cities clean, and if we were to separate them from other public health professionals and not acknowledge the role that they have provided.
Thank you for taking the time to speak with me today. It's much appreciated.
Thanks. My regards. Bye.
Thank you for listening to this mini episode of CSAP Science and Policy Podcast. This week, we were joined by Wateraid's VK Madhavan. We'll be back throughout the summer with more bonus content, including special episodes which were recorded live from the Center for Science and Policy's annual conference. You can learn more about CSAP's work by visiting us on Twitter at cscipol or by visiting our website at www.csap.cam.ac.uk. If you have feedback about this episode or questions you'd like us to address in a future week, please email inquiries@csap.cam.ac.uk. If you've enjoyed listening to our first season, please let us know by rating us on iTunes. We'd also love it if you could help us spread the word about our show. Thanks for listening.